Hello everyone. Today we will discuss about the exercises for low back pain. I'm talking about when you have a pain. Then we are extremely careful what kind of exercise we need to do and what kind of exercise we need to avoid. Of course, if your pain is excruciating, you'd better avoid any kind of exercise and take enough full bed rest. But there's a very interesting study regarding exercise and acute low back pain. It is from the book, the Your Owner's Manual by Mehmet Oz. He introduced interesting study, and the study says the patient with the low back pain, acute low back pain with the spouse, take longer time to be healed compared to the acute low back pain patient without girlfriend or spouse. What do you think? Because they do not move. They prolong, they delay the proper initiation of the movement. So you'd better start an exercise at the right time as early as possible if the pain is manageable. So let's talk about the exercises safe enough and effective enough. Our spine is sustained by muscles and tendons and ligaments around the vertebra. So you can easily think, let's strengthen our muscles around the back. That will help the recovery of the low back pain. So you may think about the exercise like this crunch or back extensions. But actually, those are not a good exercise, and sometimes it can be very risky. The first guy, Splinter, maybe a relay racer, he has a very robust and strong and good-looking muscles. But how about the guy on the right side? Maybe he's a marathon racer and his muscles looks very feeble. But you cannot say the muscles of long-distance runners have weaker muscles than Splinters because they have different muscles. Slow twitching fibers and fast twitching fibers. Long distance runners need more slow twitching fibers. They're usually used for endurance and sustaining our body posture. Low back is more related to these slow twitching fibers in muscles because our low back is supposed to sustain our weight without any seize, meaning any stopping, 24 hours. So you can have a six-pack and very bulky muscles around the abs and back, but that may not be good enough for your health of the actual low back. So we need to strengthen our deep muscles. They are usually consist of slow twitching fibers with proper exercise. These are the exercises I used to learn when I was a student, maybe 30 years ago. This is called Williams exercise, and these exercises were recommended for low back pain. And it consists of the sit-ups and rollings like exercise 3, or deep back bending like exercise 4. These days, nobody recommends this exercise. First exercise I recommend is walking for strengthening. Maybe it sounds a little bit weird. You always thought walking is cardio exercise, but this is the best exercise for strengthening your back. So I will introduce two exercises, and this exercise is the safest and most effective way of strengthening your back. But not the walking like this, but the walking like this. There are 4 points. First one, keep your belly tight with the lordosis. Lordosis means this natural curve. So you need to tighten your belly. And second, sit straight. By sitting straight, you can make your spine aligned and walk straight. Third, stride using your hip muscles, thigh muscles, and calf muscles. And fourth, swing your arms wide. By walking this way, you can effectively strengthen your back, and this is a very safe way of exercise in case you have a back pain. And second one is plank. Plank is isometric exercise, so it is different from regular crunchy or back extension exercise. And isometric exercise is the best way to strengthening slow twitching fibers. This is not for your appearance. This is for your back muscles and for back pain. So just do not be greedy, but be gentle with your back. Just do as many times as possible. Plank. So these are the two exercises you should do as early as possible for your low back pain. Even if you have a pain, if the pain is manageable, these two exercises are very safe. And second, there are two exercises regarding stretching for your low back. When you sit quite a long time, like a driving, your psoas muscle is tightened. It is inevitable. But whenever you have a chance, try to do this kind of psoas stretches. By doing this posture and maintaining just a couple of seconds, you can release the psoas. At this point, please do not rotate your back. That can be dangerous. So just gently stretch your psoas muscles. And psoas muscles are deeply related to your back pain. And next one is, it's like a cobra pose in yoga, but what I'm focusing on here is traction, gentle traction. You curl your upper body forward, just gently, until you feel a little bit of stretching on your low back. So this is the combination of back extension and traction. So using your elbow, just pull your upper body just a little bit gently. So these are the two exercises, two stretches I recommend when you have a back pain. Of course, you can add more stretches and more strengthening routine for your low back as your pain goes away. It is a wise idea starting from the safest exercise, and these four exercises are very safe and very effective. But please remember, if the pain is worsened with any of this exercise, you need to stop it right away. While doing the plank, while doing the walking, pain is worsened, please stop right away.